Okay, welcome everybody. Today our speaker is Dr. Wassermann. He actually lives in France right now, so I thought he was still a postdoc here in Boston when I contacted him, and he said he got a faculty position in France, but he's traveling to Boston for 1 week, and he's happy to give us talk then. So thank you very much.
Thanks.
In your limited time, you accepted to come here and give this talk. So Damian has an undergraduate in computer science from Argentina, and he obtained his PhD in the Athena research team in France, where he is now the faculty position assistant professor, and he was a postdoc in Harvard Medical School between the years of 2010 and 2014. So very excited about this interesting talk.
Thank you. Thanks for the invite. Good morning to everyone and bon appetit. This it has been already introduced. I will be speaking a little bit about how to describe white matter anatomy. And the main goal of that is when we analyze white matter anatomy through diffusion MRI, there's usually a full pipeline. And there is a big problem if you want to do anatomically based studies, which is how to go from what we call a tractography to a dissection of white matter structures. I know Benoit has worked on it quite a bit with really good results. This is an alternative approach to his, complementary. And then from that, we go on statistics. I have prepared an introduction to diffusion MRI. I don't know how many of you are, can I have a show of hands on diffusion?
Show of hands of who?
Diffusion MRI, knowing diffusion MRI. Okay, I'll go through it fast, but please, don't hesitate in interrupting me at any point. So the main question that we are asking when we do this type of research is, what is the brain? What is the anatomy, how the anatomy relates to the mind? There's a phrase that I love, which is the apparatus with which we think that we think. And I think it describes pretty well what we're trying to do in our research. Working within the brain has had a long, long history. The first document relating brain and function actually dates from 3,000 years before Jesus. And yeah, my eyes were the same. And it's the Edwin Smith Papyrus. And basically, this document, which is in hieratic, so it's pre-hieroglyphic era, it's organized in columns which have title, examination, diagnosis, and treatment. And basically here we have one of the cases, it's instructions concerning a wound in the temple of the subject, penetrating the bone. The examination basically says that after that hit, he cannot speak, so he's describing aphasia. And he says, I will not be treated. I will not treat it. He will provide a treatment for the patient. I don't know if the treatment will agree with today's standards, which is basically soften the head with grease and pour milk into the ears. But, it's what would happen at that point. And I bring this to tell that we have like 3,000, more than 3,000 years, 4,000 actually, of documents on brain research. And the main point with this is a lot of the problems that we try to address, usually people with a background in engineering, towards anatomy or classification of neuroanatomy are mostly artificial intelligence based, which in most cases discards all of this history. And the approach that I'm trying to present you here will try to take advantage of this lengthy history of brain research. So let's talk a little bit about diffusion MRI, which is the only type of methodology that allows us to peer into the white matter, into the fiber structure of the white matter. So we know that the brain inside is mostly composed of fibers. So some of the main tracts of these fibers or axonal packages have been highlighted, or I have highlighted here, like the unseen fasciculus, the superior longitudinal, or the inferior longitudinal tract. And if we take a look on a slice of it, what we find is this. This is parallel to the cat, that's perpendicular. So here what we have is an axon with a myelin sheath. And it's the same thing on the side. And what we're trying to measure with diffusion MRI is the movement of water particles inside of those axons. And these particles actually have a main direction of diffusion. And that's what we will try to quantify with diffusion MRI, and will allow us to actually trace these axons. So what we do is we get a slice of the tissue, we image it in different directions, and for each direction we'll have an attenuation when the diffusion is going with that direction. And with that we are trying to reconstruct what's called the diffusion propagator, which is if there's a water particle here, after a little time period, where is it possible to find this water particle? Is this clear so far? Am I telling things that everyone knows by heart? Probably yes. Should I go faster then? Okay. We can impose a model, and then what we have there is what's called the diffusion tensor MRI, which is assuming that that propagator is Gaussian. Well, you might know very well that this does not suffice in areas where, for instance, the tracts are crossing. Yeah, and mostly because the propagator shape will be this, because this is the configuration, and this is what you get from diffusion. So there's many techniques to actually disentangle that from high angular diffusion. And from also the diffusion tensor, we get what's called measures of diffusivity. You can quantify the shape of these water particles moving, and the main problem with those measures is what do they mean? There's works that said that increased radial and unchanged eggshell can be related to demyelination. FA changes are usually called integrity, but no one knows what that means in general. And one of the main problems in diffusion is the fact that we cannot actually peer into the microstructure. There's a lot of new models amongst some Benoit's contributions are there, in which what they try to do is to model a little bit better to actually try to detect different types of changes. And then we get into the multiple compartmental models. Sorry, I might skip a little bit because this is, okay. Another thing that we can do with diffusion is trace fibers. If we go back to the tensor model, if you see there's a main direction here, or like some sort of continuation flow, and we can follow it. Oh. What did? Okay, and we can follow this. Okay, there, and this is what we call usually a tract, and we hope that this represents a bundle of axons or an axonal package. And the problem from this is if we do it all over the brain, we end up with something like this, which looks super beautiful when we put it on a paper, but it's very hard to get information from it. So the main thing is how to get from something like that to something like this, in which we're classifying the tracts onto different bundles that usually have anatomical meaning, and there's been a history in analyzing their function. So how do we perform this? Well, this. Okay, the main question to ask in that is what is a tract? And in a lot of cases, we think that a tract is predefined and everyone agrees. But if we look, I mean, especially when we look at this, but if we look into the actual literature, and here I'm quoting 3 different authors, and if we give a quick read of this, it's describing the same tract. And the main problem here is that each description is completely different. They don't only use a different language, different keywords, but they use different reference points. So it's very, very hard to unify this type of descriptions. And in most cases, there's still no agreement in the names or the function or the pathway of different tracts. What we do have is that for some tracts, there's been actually dissection studies showing that what we obtain with diffusion actually corresponds with underlying anatomy. But the question of what is a tract is still open. For instance, this is very known in the diffusion field, which is a segmentation of the, sorry, it's not the arcuate fasciculus. I was going to say the perisylvian tracts in what's called like the long segment, the anterior indirect segment, and the posterior indirect segment. I'm not saying arcuate fasciculus because there's no agreement on that. I mean, the long segment is called by some as the arcuate fasciculus. Catani, in his first publications, he will call all of these the arcuate fasciculus and then split it. And then there's another discussion, which is, for instance, Catani's lab is mostly, which is great, and that's a lot of good work, is mostly based on diffusion evidence. And this tract, the posterior indirect segment, has not been found in dissection or in monkeys. So there's still a discussion on whether it actually exists or not, or on whether the fact that it consistently appears in all diffusion imaging is enough evidence to say that the tract exists. And for that, you have, for instance, a very good review by Axer from Jülich. So they work with Catherine Ammons and Carl Seals, which are the most prominent neuroanatomists of the current age, in which they review all of the different systems for the perisylvian network and all the discussion on whether which tracts exist, which are not, and which are artifacts of diffusion imaging. I really recommend this paper. It's actually great. So then we still don't know what is a tract. There are a lot of them that we know together, that we know that there's a lot of them that there's evidence. There's a lot of them that they are using a lot of neuronet and a lot of papers lately that there's no actual underlying evidence that they exist beyond the fact that we consistently find them in diffusion imaging. And whether that's enough evidence or not, it's a fight between neuroanatomists, especially a fight between the ones that do staining in animal models and the ones that actually only do diffusion on live humans. And also, there's a lot of tracts that we will never be able to tell from diffusion. I can talk about that a little bit later, just because of their shapes. So a first approach at describing white matter tracts in a pseudo-automated way comes from Zhang at the Mori lab. And what they do to describe the tracts is they take several regions of the brain that are known, and they use what we call like and or operations. So it's a tract goes, I put a region of interest here and a region of interest here, and it has to go for both. And then usually this is an artifact, a very consistent artifact from diffusion MRI that goes against using diffusion MRI to prove the existence of tracts, which is extremely common, comes from the corticospinal tract and goes into the cerebral. Super common that you'll find this, extremely known that this is not a real tract. So then they use a negation, so it cannot go through this. And they published a very wide set of rules in which they describe these tracts where it has to go through here, to like, that's the cerebral peduncle, and then it goes to the pre-central gyrus, and then it has to go to the posterior limbic internal capsule, posterior limb of the internal capsule, and the superior coronal ureta, and not go through all of this. And this was a first attempt at formalizing. The problem with these descriptions is that they are very hard to implement, yes, and that they are it's a fixed set. So if you want to then do your own studies and use these descriptions or change these descriptions because in your population you want to use a subtract or you want to use a different taxonomy of brain function, of brain anatomy, it's very, very hard to actually make it operate again, especially when this becomes a lot more complex. Am I being clear enough until here? Good, I'm not being confusing. Great. So the approach that I have been pushing for the past year and a half is something I call the white matter query language, or tell the tale in your own words. And the main idea of that is to be able to use words and descriptions in which you can type the description of your tracts in something that we try to make as close as neuroanatomy language as we can. We work with Nikos Makris a lot, who's a very prominent neuroanatomist, in analyzing and reviewing the neuroanatomy literature and trying to formalize the descriptions. And for this, we identified some operations that are commonly known and turned it into a programming language. So the syntax, for people who do some programming, might be familiar. If not, bear with me with all of these parentheses. One way to identify tracts, for instance, is to say, only the tracts that are in the postcentral gyrus. And here we have in a glass brain the postcentral gyrus and only the segments that are contained there. Another way of describing tracts that we find in literature is some that will have the endpoints in the postcentral gyrus. And again, this is the postcentral gyrus, and this will be all the tracts from a full brain tractography that have the endpoint in the postcentral gyrus. Yes? And another way is saying that it traverses the postcentral gyrus. And here we have combined it with not in this type of description and not in this type of description. And we end up with this. So we have three different operations that we can apply to any gyrus or volume that we identified in the brain, which are it only goes through there, it has endpoints there, or it traverses. Yes? And then, but this is usually not enough. Because something that also the neuroanatomists use is that they describe parallel to what they go, or if they are anterior or posterior to a different area. And for that, we also added this, which is, we can say, for instance, tracts that are superior to the amygdala or inferior to the amygdala, anterior or posterior, and lateral or medial. And in this, we think we have summarized most of the wording that is usually found in neuroanatomy literature in a way that then can be used to describe tracts. An example for this is getting the uncinate fasciculus. So the uncinate fasciculus we will describe in two modules. The first module is the frontal section, in which we will say that it goes through the insula, which is usually where all the tracts that jump from the temporal lobe to the frontal lobe on the tip of the temporal lobe go through. And then it will end up in the inferior frontal, middle frontal, or orbital front, sorry, inferior frontal, middle frontal, or orbital frontal gyrus. Yes? And on the other side, the uncinate fasciculus usually starts from, or it's considered to have one of our edges in the temporal pole, which if you try to use any type of automatic segmentation of the brain, we usually use FreeSurfer, it's either too small or too big, or it's very, very hard to use just that description for these kind of things. And this is where this anterior, posterior, or other types of particles become useful, because we say this part is in the temporal lobe and is anterior of the amygdala. So we use the amygdala, that's usually around here, to cut the temporal pole and just grab this section. And then we can combine both, saying it's in A, so it goes through the insula and through all of these gyri, and has endpoints in B, so it has endpoints in this area. And combining both, we have this. Yes? And the main goal of this type of description for us was not only to be able to formalize brain anatomy, but also that you can go to like a full brain tractography and use a FreeSurfer segmentation, for instance, and apply this kind of queries and automatically extract the tracts that then you can use for your studies. And also so sort of a utopic idea is that this will also help as a way to formalize tract descriptions and make studies more reproducible. For instance, we have submitted a paper using this with Vinod Menon's lab from Stanford, who works on children too. It's on learning, and we have added as an appendix the actual script that you use to identify the tracts that we analyzed. So people can actually try to reproduce our study and have a formal description and a very precise description of what tracts we were using and how we defined them. Yes?
Is the description of the planes in an analysis or some standards?
There's no description of planes.
But you do anterior, posterior, or
yes, but it's with respect to gyri and sulci. Okay. So the only thing that you need to, everything is structure specific. We aimed specifically to not use image coordinates. The idea is to have descriptions that can actually be translated from an anatomy book and are independent of the coordinate space. We've had that request and we're thinking about adding it to the tool because all of this is in a tool that you can download and use. But we explicitly try to not have things that like millimeter 50 and in front.
Sure, yeah.
But it's a design decision, because we were aiming to have everything anatomically based. If it happens that most people decides to go the other way, we will be more than happy to add that operation. And it's also because usually when you read the anatomy textbooks, they don't say this is from millimeter 55 in front. They say this is frontal of this region. But again, design decision. And then using this language, what we did is we generated descriptions for around 60 tracts, going through a deep review of all anatomy literature that we could find on the white matter, and working in extreme close collaboration with Nikos Makris, who's one of the main heads on this. And here we have some examples of how can you describe the rostrum of the corpus callosum, which is basically connects the orbitofrontal gyrus, so connecting the endpoints in the left and the right. That's a very simple query. This is the uncinate, which you just saw before. And this is just to show how complex the rules can get. And this is the superior longitudinal fascicle 1, which is the most medial of the 3 superior longitudinal streams according to the Makris taxonomy, which is completely different from Catani taxonomy until last year, where Catani published, or Catani's lab published a Nature Neuroscience paper using these three. So again, I'm trying to underline the taxonomy of the white matter is not carved in stone, and it's a constant argument amongst neuroanatomists. And one of the things that we aim to do with this type of approach is that you can pick your own. And you can even modify it or use a subtaxonomy or a suprataxonomy and be more flexible in your work. And here it's also to illustrate this side component in which you just put it here and it's replaced by left and right automatically. So you don't have to write things double for both hemispheres, which might sound trivial, but it's actually very helpful. Here we have, for instance, some example results of the single unbundle, the 7 divisions of the corpus callosum, according to the name escapes. It's a female researcher from Canada. I have to get back to it, who has a couple science papers working mostly on gender differences. Sorry about that. The 3 superior longitudinal tracts. Yes.
So basically, if I download your software,
yes,
and I do, let's say, free software recon, I get isolation segmentation.
Yes.
And I have the 60 description that you predefined. I can get all the tracts consistently as you define.
Exactly. It also, I mean, there's caveats with respect to you have to do a full brain tractography, and there's caveats with respect to the.
But all the target regions or ROIs that you use in the description
are there. Yes. In some cases, there's might be needed a little bit of fine-tuning on the description, but what I'm showing here, it's actually the isosurface of overlapping larger than 99.99% on 70 subjects using that. On hardy tractography, you'll see that we'll get a nice traction. So what we did here is we followed Deschamps et al. A methodology by Deschamps et al., which is we overlap all the label maps of all the tracts generated, and then we did SPM analysis and rejected through the overlap. So this is like the 0.001 p-value surface. Everything inside was common to all subjects. Here we have some extra tracts, like the middle longitudinal fascicle. And here, for instance, you see that it became super small. And that's because at the same rejection, there's a much higher variability. And this variability on this hemisphere is actually accounted in the literature. The arcuate fascicle, the superior longitudinal, the extreme capsule, the inferior frontooccipital, uncinate, cortical spinal, where we can get a very nice spread, but this spread is due to the tractography algorithm used, which is high angular resolution imaging, optic radiation, and some stratocortical tracts. Yes? Any questions so far? Okay. That's mostly what I wanted to talk to you about. Yes?
So what do you provide to your tool? You provide some tracks?
Sorry?
What do you need to run your tool? Because I need to know more about what it needs to run.
What it needs? The tool is Python, pure Python.
Yeah.
So you don't need to compile anything.
Which type of data do you
It works on nifty files and either TRK or BTK.
you need which is T1 or
You need the parcellation, which is what FreeSurfer gives you as the W and park.
data sets in the same space or how do you
Yes, you need them to be on the same space, ACPC aligned. So it's better if the brain is not like that with respect to your coordinate system, mostly for the anterior, posterior, frontal. I mean,
what do you use for the tractography?
I have tried both Diffusion Toolkit and the unscented Kalman Tractography by Yogesh Ratti and Jimmy Malcolm. They call it the two-tensor tractography for shorter, but it's unscented Kalman filter tractography because you can use different settings. This is mostly what I wanted to talk to you about. Yes.
So
Yes.
for the arcuate
Yes.
I could imagine in other primates that the arcuate could actually fasciculate underneath the insula. So
Yeah.
in that case, we would want to define it by their pattern determinations. But in some of the cases described, like using the white matter bundle as a way to define the tracts.
We don't use the white matter bundle as a way to define the
or
tract.
locations of
Yes.
right here.
Yeah. That's yeah. So you can use the endpoints.
Yeah.
So you can tell within the syntax whether there are endpoints in one section or the other.
Right. So, but
Yeah.
what, but so that would be my preferred method because there
Yep.
would be tracks that are, of course, in other locations but terminate in
Yeah.
the two places.
And you can use it.
Yeah. Okay.
The idea is that you can. I could actually bring up a demo so we can discuss it on live. Any other questions? Yes.
Yeah, I just had a plan. So you have your T1 and your diffusion at the beginning. How do you make sure they're in the same space? You can run
You can use slicer, or you can use any. Usually, our data process is we register the T1 to the diffusion weighted image to the B0, and we have processed the FreeSurfer parcellation on the T1. The B0 is ACPC aligned, and then once we have the T1 registered to the B0 using Sandy Walls's mutual information, we use that deformation to bring the parcellation inside. We usually use ANT, but it's independent. It's just you just need that result.
Yeah, if you have surfaces, you can also use video distortion.
If you give me a second, I might be able to. Yeah. Yes, what were you saying?
No, I was just telling him if you have surfaces, you also have something called video register that registers,
Oh, yeah. I have a demo prepared. Yeah, as many as you want. Yes. 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 Exactly. Yes. I have a demo prepared. I just have to put it up. Bear with me for a second. So you see how. I mean, I also was thinking of talking about statistics, but on the white matter, but I thought it will take me more time. I'm sorry. Okay, this should be working shortly. that's weird. Sorry about this. This worked this morning. Because of the, oh, it's the proxy. It's the, yeah, because I had to set up a proxy for the recording. So maybe do you mind, guys, if I turn off the proxy? Or actually, sorry about this. Okay, let's see if this works now with these proxy settings. No, I'll have to deactivate the. So this might not come up in the. Yeah, I have it. I'm just trying to apply. I'll just disconnect the network. Advanced proxies. Okay. Sorry. Well, might not be possible if I feel so. Okay, no, it might not be. But the main idea was to show you I can do it in a little bit of a less efficient way that we can do. For instance, let me see if I have tracked this here. Yeah. So for instance, you were talking about the arc of fasciculus. A way to describe the arc of fasciculus here will be like endpoints in the temporal on the left and endpoints in the frontal on the left, and it goes through the parietal on the left, for instance.